So providing support for precision medicine from an information technology perspective has several challenges to it. Generally, they fall into about three buckets. One is aggregating and integrating data into a large warehouse. The second is providing clinical decision support at the point of care based on that data. And then the third is doing all of those things in a very secure manner. So let's go back and go over all three. We're fortunate here at Penn in that we have, over the past 5 or 6 years, invested a lot of energy into building a large clinical data warehouse. We have wide, full adoption of electronic medical records here at Penn, so we're generating a lot of rich phenotypical data that we can put in those warehouses and provide access to in a secure fashion. What we haven't done yet at Penn is begin to connect that clinical phenotype data with the genotype and other research data coming out of the research enterprise and aggregate it all together into one large warehouse. We have begun that project. We have an initiative called Pennomics that takes the clinical data out of Penn Data Store and marries it with the research data from biosamples to genetics to clinical trial information and registry information and bring it all together in a unified, secure way and allow researchers to query that data on their own. And they can query that to look for preparatory efforts to do more research. They can look at it to identify cause and effect relationships, to identify clinical significance, to identify clinical variants in genetic data that's highly predictive of disease or certain treatment approaches, and basically refine the rules that we would then apply in the clinical decision support arena. Additionally, a lot of any medical record is unstructured data. Penn, again, while we have a lot of discrete data that can be acted on with rules, much of our data is still unstructured. So we've also implemented a tool called Penn that we're branding PennSeek that allows researchers and others to query the unstructured data, looking for data based totally on words and sentences and partial phrases that would match up with the free text in the unstructured data. And Penn is at the forefront of that effort across the country to identify a tool that can do that in a very easy way. And not only do we do just the unstructured data, we marry it with the structured data so you can have the best of both worlds and build very powerful queries. So that's how we're tackling the aggregation, integration aspects of data. Secondly, we're working with our EMR vendor to build the technology to allow us to have a very powerful rules engine outside of the electronic medical record that could look at that data warehouse, look at that aggregated data, and provide a rules engine that can act at the point of care, such that a physician in the process of placing an order would be given guidance as to whether a drug A or drug B is better for the patient's condition based on their combined aggregated clinical and phenotypic and genotypic data, for example. That's a pretty unique thing that will be very powerful and allow us to do many of the examples of precision medicine in a more automated way, providing that guidance and that feedback to the caregivers. Lastly, the third bucket is security. So we have to make sure that anyone looking at this data is authorized to see it. We have to de-identify the data and remove identifiers to make sure that people who are not authorized to see it can still use the data safely and securely without violating the laws and rules of HIPAA. It's very hard or almost impossible to de-identify unstructured data, so we're looking for ways to make the unstructured data even a safe thing to look at, or at least providing an environment where it is done in a safe way, a secure way. And we have to also, if we're going to share data with industry partners or with allowing our industry partners to look at our data in an aggregated fashion, make sure that they can't see any identifiers whatsoever and that they're really only able to see counts of patients that might meet a clinical trial protocol that they're pursuing. So those are the three buckets: aggregate and integrate the data across the clinical and the research domains, and then provide the ability to do clinical decision support around the rules and logic that we develop, and then do all of that in a secure way that keeps everyone at Penn within the bounds of the rules of HIPAA.